Hey y'all, hey, welcome back to Ella Ever After. Welcome to the neighborhood, nosy neighbors. If you have come back again, thank you so much for coming back. I am Ralph. I'm a D1 student at High Point University Workman School of Dental Medicine. We are going to be getting into week number 2 in this video. It is a collection of the things we covered. We took our official test for the first time. We started doing head and neck exams, patient vitals, patient history, learning about the anatomy of the mouth, different abnormalities, lesions, and even started with a bit of the bone structure of the head. So enjoy this video. Good morning, nosy neighbors. So we just took our official first test. The first one we took last week was like a baseline. This week, this is Monday, we just took our first official test, and I must say I am so glad that I was a dental assistant before I applied for dental school, because a lot of the material that we covered, anatomy, surfaces, functions of the teeth, hand washing, putting on your personal protective equipment, PPE, taking off your PPE, why the rooms are set up a certain way, how to, it's those areas. Those are all things I've been doing for the last 3+ years. So it made it really easy. Well, it made it easier to get through the test and not stress about the material. I do feel for some of my classmates who had never been exposed, so they were having to learn all of that from scratch. The most difficult part for me was just learning my eruption times and my primary lettering, because I did not see a lot of kid patients. So that was it. But right now I feel pretty good about this test. Good morning. Welcome to the neighborhood. And what is your name?
My name is Kayla.
Hi, Kayla. Where are you from?
I'm from South Florida.
Nice. And where'd you go to school?
I went to Nova.
Okay, Nova. What'd you major in?
I majored in bio.
Okay.
Professional studies.
Okay.
Minored in business.
Oh, yes, ma'am. And how do you feel about this first official test of ours on this second week of class?
Don't underestimate the little guy.
Okay.
Yeah.
Good. On my observation, I don't see any signs of distress. There's no facial asymmetry. Would you be able to squint your eyes, please? Puff your cheeks and wide smile. Good. There seems to be no abnormality among the nerves 5, 7, as well as 9. Stick your tongue straight out, and 12. Okay? Now I will be doing a palpation of the head and neck. Are you okay? Would you give your consent doing that? Okay, we'll start with the neck first. So we'll feel for the angles of the mandible, which are submandibular lymph nodes, straightening along the border of the mandible, submental, submandibular. I do not feel any observable, palpable lymph nodes along the submandibular, submental. Now we're going to go examine the anterior and posterior cervical lymph nodes. Have you rotate your head to the left, please. Go in anterior to the sternocleidomastoid and feel along the anterior and posterior, and then supraclavicular. I do not feel any palpable lymph nodes. Have you rotate your head to the right, anterior to the sternocleidomastoid. You will feel the anterior cervical, posterior cervical, and then supraclavicular. Thank you. I don't feel any abnormal lymph nodes. Now we'll proceed with the TMJ examination. So we'll palpate right anterior to the ear, and then definitively confirm our position. So have you gently open and close. So now I have been able to locate the condyle of the capsule. Open again, please. On the left TMJ, I notice a click, a faint click, which is reducing. Reducing means there is no lock, there's no jam, or the disc is not getting stuck. There is normal opening and closing of the mouth, which is compensating, which is a normal sign. Have you opened again? And close. And open again. And close. Normal range of motion. We can estimate anywhere between 3 to 4 centimeters of mouth opening. Have you slide your jaw straight out and back to the center? Normal protrusive. Have you slide your jaw out to the left and hold it? Left lateral movement, back to the center. And have you moved your jaw to the right? That's right lateral movement of the jaw, and back. This ends the head and neck exam with normal findings.
All right, we are feeling for TMJ to ensure sure there's no TMD.